Hi, I'm Dr. Noah Kaufman, founder of KaufCare Advanced Urgent Care here in Denver and a 20-year plus board certified emergency room physician. Lots of people are wondering, what can we take care of at KaufCare different from the urgent care or the emergency department? Well, first, the obvious stuff. We are not an emergency department. If you're having a heart attack, chest pain, you're having stroke-like symptoms where part of your body is weak or you can't see or speak right, you need to go right to the ER. That is absolutely mandatory. What can we do though? Most of the stuff that goes to the ER, we can take care of and doesn't need to be seen in the emergency department. You don't need to wait 8 hours to have a cut on your arm sewn up. If you want a 20-year plus experienced board certified physician doing a procedure on you versus a mid-level or someone maybe with a lot less experience or training that you might see at the urgent care, KaufCare is your choice. We can save you hours and hours of waiting in the emergency department. We can get your pain treated quicker, and we can take care of large lacerations. We can take care of dislocations, finger dislocations, hip dislocations, shoulder dislocations. We can take care of fractures. We have x-ray machines here. We have ultrasound. We can look for DVTs. We can look for gallbladder stones. And we can take care of so many other little procedures too, like ingrown toenails or an abscess, a large infection or boil that needs to be cut open and packed. We can take care of so many things here that you may want someone with a little bit more experience taking care of than at the urgent care. The urgent care is great for some things, really basic things. You should go to the urgent care. Coughs, colds, sniffles, testing for strep throat. All those sorts of things you can get done at the urgent care. For a lot of the simple things, we can do basic labs. We can also do COVID, flu, strep, RSV, and we have a new test called Febridex to tell if something is a virus or a bacteria along with your clinical picture. And that helps us decide along with you whether or not antibiotics are needed. But in terms of sewing up a cut or fixing a fracture and reducing it, we can really keep you out of the emergency department. And you might get a $10,000, $12,000 bill at the emergency department. Here at KaufCare, you're going to know exactly what you're paying because everything's published online. Just go to our website and select the pricing option, and you can look through all the procedures and see what they cost and even run a cost comparison with what they would cost at the emergency department. Now, after working in the emergency department for over 20 years, I can tell you that the urgent cares send us everything. They send us all sorts of things. And when I'm in the emergency department, a lot of times I'm like, wow, I could deal with this very easily if I was in a clinic or an outpatient setting. And when I have patients who are waiting for like 7 hours to see me in the emergency department for a complex laceration or a dog bite to their face, something horrible, I just always have known that I could take care of that for cheaper and quite honestly better because they don't have to wait in pain. The patients don't have to wait and be registered in insurance and then for months and months get these bills because they didn't know what the price was. I mean, the whole thing is insane. And so that's why we made KaufCare. That's what we can take care of. We are here for you. Let's try and keep you out of the emergency department. If you know anybody who needs to go to the emergency department or hurts themselves, just give us a call at 970-800-2515. Again, 970-800-2515. And we'll be happy to tell you if we can take care of it or not. Or just come on in. We're conveniently located at 2515 Elliott Street in Jefferson Park in Denver, Colorado. That is KaufCare. Advanced urgent care. Doctor-led. Transparent cash pricing. A fraction of the cost of the ER for many urgent problems. And built for patients who deserve to know what their care will cost before they receive it. We look forward to seeing you. And thanks for putting your trust in us. We'll take good care of you.